I have just received a text from the intensive care unit where I need to come and evaluate a patient with kidney failure. I am Dr. Rifai. I'm the virtual nephrologist, but I wanted to stop for 1 second before I go to the ICU. And I wanted to share with you the difference between acute kidney injury and chronic kidney disease. Acute kidney injury, and this patient has that, is an acute, meaning a sudden disruption of the kidney function that 95% of the time is a reversible disruptions once we remove the reasons why this patient ended up with acute kidney injury. Those reasons are plenty. Dehydration is the most common one. People who sweat a lot, people who have nausea, vomiting, diarrhea, who don't eat well, they eventually can get dehydrated. Sometimes that can happen with medications. The most common ones are non-steroidals like the ibuprofen and its cousins. So these medications are not safe if taken without supervision of a physician. This patient that I'm about to see, he is in intensive care unit with sepsis, an overwhelming infection, and that in by itself can lead to acute kidney injury. He does have urinary tract infection. Nowadays, we are using a lot of contrast for different studies, pulmonary embolus, CAT scans from head to toe, and sometimes angiography for cardiac cath or circulation testing. The contrast in by itself can be damaging acutely to the kidney. Last but not least, people who do a lot of heavy exercising or patients who take certain medications like the statins in rare cases can have rhabdomyolysis, which is dissolution of the muscles leading to kidney blockages and acute kidney injury. So, the acute kidney injury is reversible in 95% of the time, and it's transient. So our job as physicians to try to do everything we can to disrupt the causes that is leading to this and correcting them. And also, if a patient needs dialysis, they're going to need dialysis for a short period of time. Remember, it is transient. So when patients, Mr. Jones, when you ask me or your family ask me, is this going to be permanent dialysis with this acute kidney injury? The answer is 95% of the time is not, and it's reversible within 5 to 10 days. So I am very happy when I tell people they have acute and that is reversible and that is transient. And the purpose of dialysis is not to jumpstart the kidneys, but actually to support the body with artificial kidney function until the normal kidneys recover and they do their job completely and they will be able to be off dialysis at that time. So no, it is not permanent dialysis and it is not for the rest of your life. It is a transient dialysis until the kidneys recover. On the other hand, the chronic kidney disease is progressive, irreversible damage to the kidneys that take months and years to occur. The most common cause is actually diabetes and hypertension. So if that is the case, those patients eventually, once they advance, they end up on dialysis permanently or needing a kidney transplant. So there is a big difference and they're not the same disease, and the purpose of dialysis is not the same. With this, I hope I made it very clear for you about the need for dialysis, the acute kidney injury, which is transient reversible, and the chronic, which is progressive irreversible, and what is the role of dialysis. Stay healthy, stay safe. I am Dr. Rifai, the virtual nephrologist.